Hi, my name is Sagan Tekle. I am a clinical nurse specialist student at Detroit Mercy University. And here we have our patient Jonathan. We're going to continue with the head to toe assessment, starting with the abdomen. So I have the patient in the appropriate position. He has his knees slightly bent to relax the abdominal muscles and arms at the side. Have you been experiencing any pain or discomfort in the abdominal area?
No.
Okay, and have you voided?
Yes.
Perfect. So we're going to start with inspection. So on inspection, the abdomen is flat. There's no peristalsis, no pulsations. The umbilicus appears to be appropriate in landmarks, and contour appears to be appropriate. There is no discoloration of the skin, no striae, no scars, and no masses evident to the eye. So I'm going to begin with auscultation next. And I'm going to auscultate for bowel sounds, starting in the right lower quadrant. Okay, so bowel sounds were audible and normoactive in all four quadrants, and now we're going to go in and auscultate for bruits in the aortic artery, iliac artery, renal artery, and femoral artery. So we're going to start with the renal artery. Aorta, iliac artery, and now femoral artery. Okay, and now no bruits or thrills were noted or auscultated in those arteries. So now we're going to move on to percussion, starting in the right lower quadrant once again. Okay, so general tympany was noted throughout. There was no dullness, and now we are going to do some light palpation. So if you experience any pain or tenderness, just let me know. Starting in the right lower quadrant again. We're going to go all throughout the abdomen. Any pain?
No.
So no pain reported by the patient. There was no guarding, no rigidity, and no masses upon palpation. And now we're going to go on with some deeper palpation. Once again, just let me know if you're experiencing any pain or tenderness. Any pain or tenderness?
No.
Okay, so there was no organ enlargement or organomegaly, no pain reported by the patient. So I'm just gonna have you pull up your pants, pull your shirt down, give you some privacy. Okay, we're gonna remove the blanket and the pillow, and yep, sit up. Okay. So we're gonna move on to the upper extremities. So just move your arms out for me so I can take a look, and I'm just gonna pull up your sleeves a little bit more. Okay, so on inspection of the upper extremities, I'm assessing for symmetry. There's no discoloration visible to the eye, no nodules, or no masses. I'm going to go in and palpate with the dorsal side of my hand. Okay, and upon palpation, the upper extremities are warm to touch. I'm going to palpate the radial arteries. Just relax. Good. The radial arteries are 2+ on palpation. I'm going to assess your grip, squeeze my hands. Good. Make 2 fists for me. Okay. Now I'm going to push down. I need you to resist. Good. Now resist. Good. Okay. And now I'm just going to make a fist again. I'm gonna just hold your fist and your elbow. Okay, and I'm gonna have you resist while I push. Good. And then again, resist while I push. Perfect. We're gonna do the other side. Resist. Good. Resist. Good. So muscle grading was a 5 out of 5. Patient has full muscle strength. And now we're going to assess for range of motion. So just relax your arms. Good. And I'm just gonna swing. Any pain or tenderness?
No.
No? Okay. Any pain or tenderness?
No.
Okay, and patient has full range of motion of his upper extremities. So now we're gonna move on to our lower extremities. Okay, so on inspection of the lower extremities, they appear to be symmetrical, no discoloration or masses visible to the eye, no visible nodules at all, no areas of concern. So I'm going to go in and palpate with the dorsal side of my hand. Okay, and lower extremities are warm to touch on palpation. I'm going to palpate for the pedal pulses here. Okay, and pedal pulses are a 2+ bilaterally. I'm now going to assess for pretibial edema. Okay, and no edema is noted. So now we're also going to assess lower extremity muscle strength. So I'm going to push down and you resist. Good. Now resist, push down like a gas pedal. Good. Okay, now move your legs up and forward. Perfect. I'm gonna push down and resist. Good. Okay, so patient has 5 out of 5 muscle strength on the grading scale. And now we're gonna move on and assess for range of motion, so just relax. Okay, and I'm just going to move your leg here. Any pain or tenderness?
No.
And we're gonna do the same. Any pain or tenderness?
No.
Okay, patient has full range of motion of the lower extremities and muscle strength is a 5 out of 5 for both upper and lowers. So now I'm gonna move on and assess your patellar reflex. We're gonna use a distraction technique. So I'm gonna have you do this and just stare at the clock and count to 10 for me.
1, 2, 1, 2.
Okay, so patellar reflexes were 2+ bilaterally. So now we're gonna move on to assess for CVA tenderness. I'm gonna have you sit at the edge of the bed here. Okay, so to assess for CVA tenderness, we need to locate the 12th rib down to the spine. And based on the patient's reaction, we can assess to see if it's positive or negative for pyelonephritis or any kind of kidney deformity or dysfunction. Okay, so locating the 12th rib here. Okay. Now moving on to the other side. Okay, I'm going to percuss with my fist again. Okay, so CVA tenderness was negative. Now we're going to move on and do the Romberg test. So I am going to have you stand. Okay, we're going to, how about you head down here? Okay. So for the Romberg test, keep your feet together, stand with your feet together. Okay, and now close your eyes for 30 seconds. Okay, so while the patient has their eyes closed, I'm assessing for any swaying motion, any unsteady gait to see if the patient can maintain their balance, which they can. So open your eyes. So the Romberg test was negative, and now I'm going to assess for the patient gait while still staying close to them for patient safety purposes. So I'm gonna have you walk across the room to the closet and back, okay? Okay. And you can just have a seat on the bed here. Okay, so gait was normal. The patient did not have an unsteady gait. They were able to maintain their balance. No concerns for a fall risk at all. So do you have any questions or concerns for me?
No.
I'm going to review your results from your exam. I'm going to come back with a plan of care for you and some health promotion activities, okay? Thank you so much for your time.
Thank you.